Assalamu alaikum wa rahmatullahi wa barakatuh, dear brothers and sisters of the Muslim community in Saskatoon. I am your brother, Dr. Ahmed Shoker, part of this community for over 30 years. I am still in active practice in medicine. I'm a specialist in general medicine, kidney diseases, and transplant patients also. I am here at the Saskatoon Dawah Center to share with you an important message. I will restrict what I'm going to share with you to the scientific and the medical aspect of this COVID-19 outbreak pandemic. The religious views of this outbreak is crisply clear, and therefore I will focus on the medical aspects alone. I will invite, however, everybody to read many of the scholars' opinion that's very clear about the Muslims' duty during this hardship. What is this virus? Why we are so concerned about it? This is a unique, that's what we call super spreader. If you compare it to the flu virus that many of us will get it every year, it's extremely more potent. In fact, the ordinary flu virus, we know, it kills only 1 in 1,000, God forbid. We do have a vaccine, and we have some medicines that can help us to go through the regular flu virus. COVID-19 is different. We do not have a vaccine to prevent it, and we do not yet have any active treatment. So the only way we are going to win this pandemic is simply by observing preventative medicine. This virus, like all viruses, is spread from living cells to living cells. It means that we, the humans, alive, are the only way that this virus can be contracted from one individual to another. There are two ways how that can happen. First, when someone sneezes, when someone coughs, or by ordinary touches. Those very minute droplets can be transferred, go through the nose, the face, the mouth, or even the eye to infect another person. The second way is that when we sneeze or cough, some of those droplets will stick to fomites, that is surfaces. For example, doorknobs or any surface like the desks, beds, and so on. The virus can live up to 3 days. And therefore, if you sneeze and you leave in peace, another person will come and touch that area, he or she will be exposed to infection by this virus. This virus kills about 20 to 40 in every 1,000 compared to only 1 in 1,000 that we know from the ordinary flu virus. Therefore, we have to be extremely careful, and until science would help us to devise some ways to have a vaccine or a medication to treat it, our only way is simply to avoid exposure to it. So what should we do as Muslim communities? There are 5 points. Quick, share them even with your children. Number 1, social distancing. That means avoid social gatherings, including inside prayer areas. As I said, the only way for this virus to keep alive is inside living people and to be contracted from one person to another. Therefore, we should maintain social distancing, including social and spiritual gathering. We should use virtual meetings we should communicate by other methods rather than contact. Number two, personal hygiene. All of us have to be careful and wash our hands frequently. Alhamdulillah, we as Muslims, we perform ablution 5 times a day. And when you do that, let the water run for 20 seconds each time. Use disinfectant regularly and clean all foamits or surfaces with the mighty Lysol or any other disinfectant. When you do that, then you help really mitigate and prevent infection by this virus. The third is self-isolation, which we are close to do now. Make sure you keep your distance, stay home. You do not have to go outside except when you need to. And those who have to work to serve the community, just be careful. Maintain distances and wear facial mask. How far would you keep yourself from others? It is said 6 feet. So all the time make sure to maintain that distance by 6 feet from one another as much as you can, except of course when you are at your own home with your own spouse and children. That is a different story. Then what will happen if you feel having a flu-like symptoms? Number one, self-isolate. And if it gets worse, self-quarantine. Self-isolate and self-quarantine are important. Number one, if God forbid you have the virus, you do not spread it. And if you don't allow your weakened immune system by whatever you have to be exposed to someone else who may have the virus. I would advise all of us to maintain update with what our government doing. You got to Google every day coronavirus updates. You'll get more information, what you should do and what you should avoid. Lastly, I would remind ourselves that our Prophet, peace and prayers upon him, established the principle of preventative medicine when he asked us to quarantine ourselves from getting exposed to infectious agents. This is in our core beliefs and as practiced by Hazrat Umar radiallahu anh. Therefore, we as Muslims, not only we have to comply with what we hear every day, but we have to be leaders. Maintain your distance. Keep the hygienic principles as high and adopted, and be careful. God bless. Wassalamu alaikum wa rahmatullahi wa barakatuh.